Florida ranks almost dead last in the country in the number of uninsured children. A big percentage of those children are the sons and daughters of immigrants who are living in the U.S. legally but do not yet qualify for health care coverage. The upcoming Florida legislative session could change that. SNN local news reporter Jim Spiewak has more.
A bill will be introduced in the upcoming session that, if passed, could expand health benefits to legal immigrants' children. A similar bill did not make it through the last legislative session, but what could be different this time around is that the bill, unlike in years past, finally has a sponsor in the House. With nearly 500,000 without coverage, the state of Florida ranks 49th in the country in the number of uninsured children.
We call it the new poor, people that have never had to rely on services before, but now they are reaching out for other alternatives for something that is basic as health care.
The national average of uninsured children is 7.5%, while 12% of Florida's youth are living without adequate coverage.
The under or uninsured, there's very limited services for them if they need to see a special doctor or a special type of pediatrician.
Leading the way is the Hispanic demographic, with many of those families living at or below the poverty line.
It's become this scared culture, this fearful culture that this isn't my home, this isn't my country, and when you have that, it comes with certain fears, right? I mean, whether it's a language barrier, whether it's they could deport me or my family.
Many of these families are living in the U.S. legally but haven't been here long enough to qualify for the benefit. Florida lawmakers have tried and failed in previous years to pass legislation that would expand health benefits to children of legal immigrants. And now they'll try again as a new bill will be introduced during the next legislative session.
Legislation in a positive manner is always the first step. You take that off the table, now you can start to address real issues. You still have to educate them on why they want to get insurance and how to do it.
The session will begin March 5th and runs for 60 days. And this is a big demographic we're talking about here. Hispanic children make up 40% of the nation's uninsured children, while at the same time accounting for 24% of the general population.